please welcome my guest, Sarah Arthur, who's the Director of Community Engagement for Novant Health's Coastal Region. Thank you so much for being here.
Thank you.
Good. I'm so excited to have you here because community engagement is near and dear to my heart, yet I don't know what all it entails. There's a lot more that goes on than just having events. But let's start with your background. I always like to introduce my guests to the community. So tell me about your background.
Yeah, I grew up in Greensboro, North Carolina.
Did you?
I moved to Wilmington about 10 years ago. I got my undergrad as a social worker at Appalachian State. I hope everyone saw the game recently.
I did too. My granddaughter goes there, so yeah, it was really exciting.
And then I went and got my master's in social work at UNC Charlotte. So I started my career in social work helping homeless families and doing therapy, and then moved into managed care with Trillium, our local MCO. And then started working at New Hanover Regional 8 years ago, and then transitioned over after the merger with Novant Health.
Wow, that's interesting. I didn't realize you were a social worker. Yeah,
Yeah.
that's a great background to have in community engagement.
Yeah, it's a good perspective, I think.
I think it brings a lot of value. I understand you were in case management.
Yes, I started my career in case management. I worked on progressive care unit with a lot of stroke patients or patients on a ventilator. Then moved over to the med-surg unit where we had a lot of patients that were struggling with either a mental health or substance use disorder and had a subsequent medical need related to that. So I really enjoy working with that population. I have some personal experience with family members and substance use, so they're near and dear to my heart, and I feel like it helps to have an advocate for them.
It does.
And that's what I really enjoyed doing when I was working one-on-one with patients. I moved into overseeing our whole social work team. We had 26 social workers at the hospital in all different areas. It's so exciting to see what social workers can do and work with physicians.
Yeah, it's so different now.
Yes.
For social workers.
Yes.
And they're so important to our facility, I know. But in general, I think they're one of the most important people in a hospital.
Yeah, they're often overlooked when it comes
I
to
know.
thinking about discharge or thinking
know.
about grief and loss.
Yeah.
There's a lot that they're there for that sometimes the physician or the nurse may have already left the
Right.
side of the patient.
Right. Yeah. So from there, you shifted to community engagement. So, what does community engagement mean, and what is the scope of your department?
Well, we really try and focus on the mission of upward mobility and health equity for our community. So we have 3 different pillars. We have a relationship engagement piece focused on charitable contributions and sponsorships to local nonprofits, and those partnerships where we're making connections in the community and with our local hospital on how we can serve patients. We also have a pillar of community health workers, so they are
Yeah, I'm interested in
yeah,
that.
they are individuals with lived experience that go into patient homes. So when I say lived experience, I mean that they themselves have been on Medicaid or may have grown up in public housing.
They kind of know the system.
They do, and they've overcome
and they
those barriers.
speak the language.
They can truly build rapport with a patient compared to a social worker or a physician or a nurse. And they really meet someone where they are. And I think being in a patient's home also makes a really big difference.
And so that falls under community engagement.
Yeah, we have about 9 community health workers, some with different levels of expertise. We have 2 bilingual community health workers, perinatal, one that focused specifically on elderly patients. So,
And are they tied to primary care in some way? Or are they?
some of them are. We try and partner with Novant Oceanside here in Charlotte as one of our practices, and then a few in the Wilmington area that have a high majority of patients that are on Medicaid coverage, because we know that there are often some other barriers that comes with that population.
I didn't know we had perinatal
Yeah,
I didn't know we did
she
that.
also is paired with 2 doulas.
Oh, nice.
Yeah, so they are with the patient, throughout their birth. They
Yeah.
go help them in labor, and
Oh,
then
wow, that's awesome.
yeah, they follow for a year after birth as well.
Wow. And there are how many of those folks?
Two doulas and 1 perinatal community health worker, and then 8 other community health workers.
Wow.
Yeah.
That's really interesting.
And then our other pillar is community health services. So that's going out to health fairs,
Oh, okay.
doing health screenings, trying to really push preventative care with individuals so they know what their numbers are and they feel empowered to take control or possibly prevent a chronic condition like diabetes or hypertension.
So today I want to talk about food boxes. I heard that Novant Health provides food boxes at some of our physician offices. So is that sponsored by community engagement? Is that how that works? And where do the food boxes come from? How do we come
Yeah.
up with those?
It's a really exciting program. It started in 2019, and it was originally a grant with the Blue Cross Blue Shield
Oh,
and a partnership with the local food bank. We are really dedicated to addressing the social determinants of health for our patients, so that includes food insecurity, housing, transportation, interpersonal violence, financial strain. So our nursing team, either in the hospital or at a physician office, will ask 2 questions for a patient around what we call hunger vital signs. And it relates to whether they've had enough food in the past year or whether they need food today. And it's sad to hear how many people don't have food for that day. Often,
Yeah.
I think we know people choose to buy food over medicine sometimes, or vice
absolutely.
versa.
Yeah.
So we provide a patient with a food box of shelf-stable food. It lasts about 7 days, and then we give instructions on how they can look at sustainable supports like SNAP benefits, or most
Right.
people know them as food stamps, or local food pantries.
Yeah, and there are a number of local food pantries that, and that's a good way to educate people about the food pantries.
Yeah, and they're wonderful partners too. I think food pantries touch people in a way you don't realize sometimes.
They do. I wanted to touch on the health needs assessment that we work on every year. Tell me about what is your role in that?
So we partner with the local health department and then Dozier Memorial Hospital on a community health needs assessment. And the goal of that is a large survey looking at what does our community think we need. I love it because getting the most community feedback we ever get in one setting. And this year we got over 700 responses. And in that process, we look at the data.
That's more than I think we've ever
It
done.
is. It definitely is. Our community showed up.
I used to have to work on that. Right.
And we'll work on a hospital plan as to how we want to address it and what we have control over in terms of addressing those needs.
And how often do we have to do community health needs assessments?
We do it every 3 years.
Wow.
Yeah, and we really enjoy being a part of that.
Yeah, that's great. Well, Sarah, this has been so amazing. I've learned so much today, and I hope you'll come back and join us again sometime.
Yeah, of course.
I just think you have so many stories to tell, so
Thank you so much.
thank you.